now I want to introduce our next talk. When we first started thinking of this theme, as Gwen pointed out, we realized that we had worked with so many people who were doing such good work in communities and in partnership with communities. And one of the first people we thought about was Alma McCormick and Suzanne Held, who have been working in the Crow Nation for many, many years and who have established and grown and nurtured an extraordinary partnership that has had so many benefits for their community and tells us so much about the kind of work that can be done. So Alma and Suzanne came together. They braved a spring snowstorm to drive through the passes and be together and talk to each other. And they recorded this a few weeks ago for us. And it's they came up with the name, and I think it says a lot. It's called Sacred Partnerships.
How are you? It's good to see you. Today is a good day. My name is Alma McCormick, and I am the Executive Director of Messengers for Health, and I am a member of the Crow Nation. I am a fluent Crow speaker. I am, like I said, been working for a long time with Suzanne Held as my partner with Montana State University Bozeman. And I'm so happy to be able to be here to share with you about our relationship and how we met and the work that we've been able to do together. And I'll go ahead.
And I'm Suzanne Held. I'm a faculty member at Montana State University in Community Health and have had the honor of working with Alma and other members of the Apsáalooke Nation for a long time now on different health projects in the community, focused on the interests of the community, using the strengths of the culture and solutions that are in the community and from the community.
And I just like to share, for me, I always have to share that I lost a little twin daughter to cancer. She was just a baby when she passed away, and just how that put that passion in my heart for what I do and how I feel and how I care about my people. In the Crow culture, we have close kinships. We have a clan system. We value life. We value each other. It's our greatest value, and our spirituality as well. And so after I lost my daughter, the passion that I have in my heart to just want to help people, and my community, community members, they know who you are. They know what you've been through. They know how you've coped with different trials and things that you've gone through in your life. And that's how you are considered to be someone that's trusted. And so for me to go kind of step into this leadership divinely, I always say it was divine. Even in meeting Suzanne, when we met for the first time, and we had both been kind of involved in the state Montana Cancer Control Program, as it's known now. Way back in the day, this is a screening program that was developing and getting ready to get off the ground in the state of Montana. And that's when I met Suzanne for the first time, and that was in 1996. And from that time forth, we developed that relationship. She was just someone that was so easy to talk with. And even though she had these credentials, she was able to just kind of talk with me just in a way that I was able to understand and kind of guide me to put together this little proposal so that we can begin a little outreach project here with the Crow women. And so I'll have Suzanne share a little bit more about her meeting with me too.
It was, as Alma said, just a really comfortable start. And I think we've just been linked arm in arm ever since. And one of the things that we wanted to visit about was, as Alma talked about her leadership and about her history and the integrity that she has and how people have seen her have a hardship and come through it. And we've talked about what's valued or recognized in our different communities and how we really help each other bridge the community. So I know that Alma always has my back and I always have Alma's back, because we come from these different worlds of academia and the Upsalica community. And when people want to know about me and my leadership at the university or Alma's leadership at the university, they want to know, what kind of degrees do you have? What kind of presentations and publications have you given? What kind of grant dollars do you have? But here in the Crow community, it's really about where our hearts are, and that we follow through on what we do, that we say we're going to do something and we follow through with that. And so there's really these different kind of values and recognitions. And so we've talked a lot about understanding that from each other's point. And so when we're at the university, I can talk up Alma's publications and her degree and all of the things that we've done. And Alma can talk about our partnership and my heart to community members to let people know where I am.
Yeah, and it's just like, I think the best way to describe it too is just building that bridge, and the community, with the history of all Native American tribes, and the historical trauma and everything. So that trust, it's really important. They call, consider someone from that was not from the community and not Crow Indian, an outsider. And so those were some things that we were able to work together in a manner. And like Suzanne said, just coming and just sitting with us. I always say, you don't have to just go to where the people are at, just sit around the table with them and listen and have a meal. And that's what Suzanne did, just with an open heart, never with an agenda or a plan, allowing us to take the lead in the health, issues that are important to us. Even in our first area of health, was cancer awareness and prevention. But that was something that Suzanne asked me, even though, yes, she's aware, but, she asked me if she was to apply for this grant through American Cancer Society to address cervical cancer, would that work with the Crow women? And how would it work? And she just drove 3 hours from Bozeman, just sat around a table with us at a little restaurant with several other Crow women, and we just allowed us to brainstorm. And that is the model of Messengers for Health. A Crow woman talking to another Crow woman, being able to, yes, work together, community-based history research, allowing the community just to really take the lead and say, this is how we can do it. If we do it this way, it'll work. And just having that open mind, it's not all about Suzanne learning about us in order to work with us. We also have to know that she has a culture. She, has a background and things, that not just representing, the institution, but just who she is as a person. And yes, there was times, that she felt, she did something that was maybe kind of offensive, but, we'd always talk about it. And, and then I was able just to kind of, explain to her, yeah, maybe we'll go about it this way. So we've learned a lot, vice versa, back and forth, even for myself, I'm having to learn about the things of research and, the institution and how things are there. But, like she said, we have each other's back, and I'm here, and just as the liaison, you might say, for my people, and bringing in someone from the outside, but yet that trust in my people knowing who I am, and that knowing what I've gone through, and that I mean well. And then, they began to just kind of gradually let their guard down and listen to Suzanne, and they're in tune, this person and these other individuals that we call our Messengers family, the students and other staff, they're here, their heart is in it. They really want to help us, and they're sincere. And then they began to just receive it, let their guard down, yes, we are here. There's nothing, uncomfortable here, or, I don't think I've ever heard him say anymore about an outsider, she's just been a part of the messenger's family. She comes, and it doesn't matter if she meets new people, new board members, new people that have come on staff, that are pro-Indian. It's just the way she is, and she's been accepted and welcomed, and that's how we've worked. And we've really built a pretty strong bridge between MSU Bozeman and the Crow community, and the people are aware of that, and it just has been like, yeah, it's been a long time. We're talking, we've met in 1996, like I said, and doing work since 2001, and still going strong. And anything else Suzanne would like to share?
Yeah, I think I would add a little bit to what Alma is saying of it's called community-based participatory research, but we really know that it's community driven, it's community led, and that I'm white. I grew up in Wisconsin. I'm not Crow. I'm not from this community. And so 100%, I know that always Alma is leading me with a gracious hand and a very gracious heart. But my role is, as Alma said, I have some skills, I have some things that I've learned that I can offer, but it's always the community that's leading. And so it's always me and the other folks from MSU who are listening and learning along the way. And that's how we slowly built trust. And that it's not like there's a stamp that says trust is done. We're building trust forever, like for the rest of our lives working together. It's constantly, as new people come in, as we meet new people, there's new students, there's always more trust building to do, and more like making that bridge even stronger and more solid, and able to handle those difficult things, as Alma said. Like if I make a mistake, which I do, that Alma can lead me back to or share with me what the proper protocol is or things to do. So that's all kind of, I think, information for people who are interested in developing partnerships. We also wanted to talk a little bit about the stories.
Okay. And so in this partnership and with community-based research, I have to say I am blessed as being, one of probably the few indigenous tribes, and I can say in the state of Montana for sure, of taking this step of doing research in our community. And when it's done properly and appropriately and respectfully, it will work. And there's lessons learned, like we said, in as we've gone on this path and this journey together, and things in research that have come out so strong. I have to share with you, as far as Western research, as we say, you listen, you record a person's story. For example, you do an interview, and that person's story is recorded. They've shared their story, they've shared their heart, and culturally, that's how we share wisdom and words of advice, is through stories and our lived experiences. And so after this story, and this was a while back as we were first doing this, we had some interviews that we had translated and made hard copies, and we had our advisory board sitting around, our elders, and representing our community and younger people as well. We were sitting around the table, and we were wanting them to kind of we had them review it and read it over and maybe pull out those common themes. And we had a student working with us at the time too, as we've always had students. And the student was kind of leading this conversation with the board. And it seemed like there was this pause, and she was explaining to them what we kind of wanted from them as far as feedback. And there was kind of silence. And then it seemed like she was trying to explain more. Do they understand? And then pretty soon one elder woman said, "We don't take things apart." And that just was a turning point for us, that you keep things whole. You can't just take someone's story and just start pulling from it. You honor that story. You keep it whole. And that shifted the way we analyzed after that. From that time forth, it was a good lesson learned, you might say. And yet, how research can be done in a manner that's just most appropriate. And yet, you receive the richness of it. And so we began to realize how important it is when these stories were recorded that we actually would sit and listen to the voice of the person being interviewed, listen to their voice and their story. And after that, through discussion, the common themes will come forth and even deeper issues. And that happened for us in our last research intervention, and it was very successful and effective. And so that we've learned, believe me, we've learned things, lots of humility. I say, you can't train someone to have cultural humility. Humility comes from the heart. And I feel that Suzanne's heart, she humbles herself. She's passionate. So there's key things, I would share with researchers, you have to be passionate. You have to be open, willing to listen, willing to learn. We've grown together. And just having that heart that you can humble yourself and learn about another's culture, and it's mutual. We learn about each other, and I've grown. She's gently nudged me, and I furthered my education. So it's kind of like, I feel like, she says, she's learned so much from me, and I've also learned from her. And I've went back to school and furthered my education because, as we do this work in this journey, and as we want to continue, and I say, we're going to go on. We plan to do this work forever. There's a lot more to be done. There's health disparities and things that we want to address. And so this is like a lasting, relationship. And even when after we transition as a community-based participatory research project into a nonprofit, she was by our side, volunteering her time. She didn't, just say, well, you guys are going to be a nonprofit, you're on your own. I've got all these publications and now I'll go move on. No, that was never the case. This relationship, you have to consider it to be kind of something that where you've given your heart and it's lasting, and you're willing to just go above and beyond and just even volunteer your time to be by our side, to help us in this transition. And now we are a nonprofit, in 2010, I guess it's been like 13 years now, and we've done work, been going for over 22 years. I mean, it's just been amazing. And I'll allow Suzanne to share a little bit too.
I don't think I have anything else to share. Alma always does such a beautiful job of sharing. Yeah, I think that's it for me.
And I could go on, but we'll stop for there for now. But thank you so much for allowing this time.
Thank you. Thanks, Alma, for being my partner.
Yes. For life, we say we're going on. No retirement for me.
Alma and Suzanne for that lovely conversation. You two truly exemplify the definition of partnership. When you talk about listening and learning, cultural humility from the heart, leading with a gracious hand, building trust is forever. It's not a one and done. Our chat with our participants is going wild. People, their mindsets have been challenged of how they approach research. So thank you all for the examples that you all set. And I want to ask, because you didn't get to dive into this in your video, but what are some tangible results from your partnership from this 20 years? What are some things that you all have been able to create and that impact?
And this is Alma. I can go first real quick. the results is there's been improved health amongst our people. And for a Crow woman to start going in and having a pap test and a mammogram, even though there was cultural taboos that were just kind of keeping them from going, that was huge. Significant breakthrough in cancer awareness in the Crow community, and then impacting the men. And so I was thinking about it today as I was thinking about my program, and I was everything we've begun, we want to sustain. We've been able to sustain our services as well as begin to endeavor into other areas of need. And right now, our last research intervention of supporting one another, people with chronic illnesses, to improve their self-care or to prevent chronic illness, and going on to working towards improving mental and emotional wellness. And so it's like, it's worked, it's effective. The people were touched. There's more people to reach. And so I just feel like those are the results. From the very beginning, we told people when we did a survey with Crow women, the information you're sharing will directly benefit the people. And I am so thankful and blessed to say it has. They have seen it, they believe, they trust us. And those are some of the tangible results that we have seen. I'll go ahead and have Suzanne share.
Thanks, Alma. I think a couple other things that I would mention, we mentioned that we have a lot of students that work with us, and we've had dozens of students over these decades, mostly Indigenous, a lot of Apsáalooke students, and we call ourselves a research family. We don't talk about ourselves as a research lab or team, it's a family, and we take care of each other. And we have really seen success in students in medical school, students working in public health. And I think that their success really comes from being held in this partnership as they go through their studies. Alma mentioned we just finished a NIH-funded program called Banela, which is to give advice. And this was a randomized control trial to help improve and support chronic illness self-management. And we had another wonderfully disruptive experience doing this. We always use mixed methods, and the qualitative and quantitative data were very different. And one of the big reasons, so the qualitative data showed amazing changes and the quantitative data not. And one of the big reasons is that there was a 80% what is called contamination in Western research, that the waitlist control group was not only exposed to the program, but made significant changes in their life before even becoming a part of it. And so we've published a paper about, we really see this, it's a cultural strength of sharing what you learn with others, which is very different from a Western research paradigm. And we feel like the program is successful because of the sharing. And I pulled a couple little quotes. I'll just read two of these from participants. I learned to take my health concerns more seriously and to ask questions of my healthcare providers when I have medical appointments. I feel more confident in improving my health. Another participant shared, I've had a good experience with the program. It's good to know that I'm not the only one that is going through the things I do. I was also able to share with my adult children the things I learned about managing my health. My two oldest sons have taken control of their weight issues and have lost weight. They're no longer on high blood pressure medication or diabetes medication, and I hope to do the same. So we have a paper under review right now, really discussing these two stories of the project, the outcomes, and what that means, and how we can go forward doing an even better job of evaluating from an Indigenous perspective.
That is beautiful. And we look forward to being able to share all of your findings and the future of your work with our community as well, and with people who attended today. And one last quick question in our last couple of minutes. What is one recommendation that you would give to people who are in the audience today who are looking to build and nurture a relationship like you all have?
And this is Alma. Again, I would just say, come with an open heart and with passion and a willingness just to put aside everything and be willing to mutually and respectfully learn from one another and listen. Listen with your heart, and something can happen.
And I want to give a very small and specific recommendation, which is you may have noticed that Alma leads when there are questions that are asked of us. Alma leads when we present. I think faculty members, people with a lot of training, we're used to like jumping in, giving our opinion, telling people what it is. And so it's sitting back and really, truly looking at how is the community leading? How am I listening? Because our egos are just constantly getting in the way and jumping in. So taking that seat next to Alma and letting her drive. And I would say that would be my biggest piece of advice, is just constantly asking yourself, who's driving this? How am I stepping in? How am I listening? And really putting that into practice every single day.
I love that. Thank you two for both talking the talk and walking the walk. Thank you for this beautiful conversation. And next, we will have the power of co-creation in developing tools to advance trust.